Doctors don't know really anything about weight loss or nutrition. This is actually not a myth. This is actually true. The sad part is that the vast majority of weight loss, diet, and nutrition and health type books that have to do with weight loss are published by doctors. Something like 33% of all weight loss books are published by physicians, whereas only like 2% are published by nutritionists and registered dietitian or people who actually know about weight loss. So how do I know that doctors don't know about weight loss? Well, there's tons of studies. I'll put some of them up here. The lack of educational training in weight loss and nutrition specifically is really, really sad. This is why you have physicians going online, writing books, making up stuff about weight loss. Oh, well, just eat keto and eat tons of fat and you'll lose weight, or only way to lose weight is intermittent fasting. And no, those are not the only way to lose weight. Those are ways to lose weight that can work if used appropriately. However, without question, they are not the only ways to lose weight. My biggest problem with some of these books and physicians and these people that these internet gurus is they get out there and say this is the only way to lose weight. This is not the only way to lose weight. There are 1,000 different ways to lose weight, and they all could work. I always tell people you should select the one that you can stick to the most, or the one that feels the least restrictive to you. A lot of people who actually have studied nutrition and weight loss talk in this way. One of them is Dr. Lane Norton. I recommend his book tremendously, Fat Loss Forever. Grab it. But he recommends generally that people should follow the diet that feels the least restrictive to them. Sure, almost all these diets will cause a calorie deficit, and that's kind of how they work. But you shouldn't just follow one because somebody said it's the only one that causes weight loss. One of the other things I find is funny, and I give these lectures all the time, cardiologists. We train cardiology fellows, been training cardiology fellows for almost 10 years now. These are future cardiologists. If you look at the American College of Cardiology, they published a study, I'll put it up here as well, on what deficiencies do cardiology fellows have in their training going forward. We all know in this country that the single biggest problem right now is not smoking anymore. It used to be that was the single biggest problem. It's not smoking anymore. It's obesity. The number one but at least the number one thing that is worsening health outcomes right now is obesity. Now, we could talk about that on a whole other level, but obesity in and of itself worsens almost every medical condition you can imagine, whether it's heart disease, arthritis, knee replacements, joint replacements, multiple types of cancers, dementia, depression, anxiety. Almost every part of healthcare and mental well-being, obesity worsens. The American College of Cardiology, the American Heart Association recommended these guidelines. They were just published, like literally I think 2019 or maybe 2020, on what we should focus on next when we're teaching fellows, future cardiologists, upcoming things. Like what should we focus on? It's a very long PDF. It's a very, very long article. Not once in that article, if you looked through it and read it, did they talk about obesity, weight loss, nutrition, any of the medications that we can use for weight loss now. Not a single word about weight loss at all. So not only is this like, if you look at the American Family Physicians and all these other societies that have to do with more primary care, but even the American Heart Association, the American College of Cardiology, who trains us and licenses all of us, not one single mention of obesity or weight loss or nutrition. So yes, physicians severely lack training in nutrition and weight loss. No question about it. Every study ever published shows that. No question about it. The question is, what do we do? So now as a patient, you go to see your doctor, and you're like, oh my God, can I believe what this lady is telling me? This doctor is telling me this, and that. Is this true? Like, am I really only supposed to eat fat, or am I really only supposed to eat one meal a day of 200 calories? Like, how do I know this is all true? The problem is the public trusts us. We're physicians. We are, entrusted with giving people correct information that is scientific, evidence-based, up to date, all of that, and we literally have no freaking clue when it comes to weight loss, and nutrition. So I highly recommend as a physician that you send these people and these patients to specialists. Send them to registered dietitians or nutritionists, whatever it might be, somebody you trust and has had good results and has a good track record. Nutritionists also and registered dietitians don't necessarily have the same philosophy as you or I of eating a balanced diet and whatnot. They may be pushing fad diets too. I don't know, but find one you trust and talk to them, figure out their philosophy. Find one you trust and know that's very open-minded, is based on research and nutrition, and get your patients to see that person. That would be the number one thing I would recommend. Number two, you need to get educated. You're a doctor. If you're a surgeon or, into something totally different, fine. But if you're into primary care or any of the primary non-surgical fields, you need to know how to counsel your patients on basic weight loss. Now, is it possible for a doctor to learn about weight loss? Yes, just like it's possible for almost anyone to learn almost anything. That's the beauty of being human, is we can study and learn. I would recommend starting somewhere. My book is 160 pages, and it gives you like a basic start on weight loss, getting a proper mindset around weight loss, having a healthy relationship with food and exercise, how different exercises affect weight or don't affect weight, how different food groups are, affecting your weight or not affecting weight, what all the different diets do, all the science behind diet and what actually works. A lot of it almost all of it is in my book, and plus there's a huge appendix of all the studies that I use and talk about in my lectures. Or you can go on YouTube. I have a weight loss playlist. This will be in that playlist, but look at my weight loss playlist. If you go through that, it's like basically getting a master's degree or a PhD in weight loss. You will know more about weight loss and proper weight loss than any other physician. Unfortunately, it's not something taught in medical school. This has to kind of be self-taught. There is something called obesity medicine, and you can go and become licensed or certified in obesity medicine. Highly recommend that if you have the time and or money. Or you could start dibble-dabbling in this, over time, reading all the research, reading books, but, the right books, the right research. You should read all of it and have a totality of knowledge, but I've distilled it all down into my book. I feel like that's probably the best place to start for most physicians. And it's not dry. It's not just study after study after study. It's a good read. It's only 161 or 162 pages. Highly recommend it. But definitely we don't know about weight loss. We really don't. We need to stop pretending. Like you see some of these internet doctors that are selling books, millions and millions of books about weight loss, and then you go read it and you're like, that's not even what the studies really show. And then like, oh my God, he picked this study from 1932 done on rats. We actually have this now done on humans, and we know that the result is different. We don't need to look at a rat study from 1960 when we actually have current human studies. So definitely, I highly recommend getting super educated on this topic, because this is not something going away. We have more gyms in the U.S. now. The sugar consumption has actually gone down since the 1970s. All these trends that we talk about all the time are improving, but we are getting more and more overweight. We still have not peaked and turned around and started losing weight. There was a brief moment in time, I believe in like the mid 2012 or 2013, where obesity had peaked a little and started coming back down again, but then it took back off again. So we are still getting more and more overweight according to the CDC, and pretty much any way you measure it. Even children now, up to almost 20% overweight. Highly recommend we attack that problem. We don't want our children having the same problem. So share this with somebody who needs to know it. Grab my book. Not like trying to do a plug, but all the studies are in there. So grab it and read it, and you'll be like a really good doctor that talks about weight loss in an educated way and very, very reasonably.